Hello everyone, my name is Julia. Today I'm going to present my research paper to the class. First, I'm going to talk about the introduction and give you some background of my research title. And then I will walk you through the literature review, methodology and implications and limitations. My research title is The Effects of Hydroalcoholic Extract of Fumaria parviflora Supplementation on Metabolic Parameters Components in Diabetes Type 2 Patient, a randomized double-blind placebo-controlled clinical trial. The introduction section includes 6 sections. The first one is the definition of type 2 diabetes. Diabetes is a metabolic disorder characterized by a high level of fasting blood sugar, also known as hyperglycemia. The etiology of the diabetes is caused by the cellular levels of resistance to insulin function or deficiency of producing a secretion of insulin by pancreatic beta cells. Um, Diabetes has some complications, which include retinopathy, neuropathy, and nephropathy, and microvascular complications. The treatment of type 2 diabetes include chemical drugs and supplementation with herbal or botanical extracts, which might mitigate the occurrence of several diseases complications. The Fumaria parviflora is an annual plant that grows in broad regions of South Asia and the Middle East. The purpose of the current study is to evaluate the effect of hydroalcoholic extract of Fumaria parviflora on metabolic parameters in diabetic patients. So, the introduction section. Several in vivo studies have shown the beneficial impact of Fumaria parviflora extract on diabetic animals. For instance, Akhtar et al. In 1984 suggested that the extract of this plant might have some hypoglycemic functions in diabetic rats. Besides, it has been demonstrated that the extract of FP has a substantial influence on reducing the levels of malonodialdehyde or MDA, TNF-alpha, interleukin-6 and interleukin-1 in streptozotocin-induced diabetic rats. Nonetheless, to our best of knowledge, there is a dearth of studies examining the effect of hydroalcoholic extract of FP on metabolic indices in patients with type 2 diabetes. As a result, the current study aimed to evaluate the effect of hydroalcoholic extract of FP on metabolic parameters in diabetic patients. In the literature review section, several animal and celluloid studies have shown the beneficial effects of FP effects on glycemic parameters and inflammatory markers. Although very few human studies address the beneficial effects of FP, several celluloid and animal studies confirm the positive effects of FP on diabetes and its associated complications. For the literature review section, I'm going to just give you a brief table of this section, but I'm going to elaborate upon the literature review section in the research paper. So here I include just 6 studies addressing the effects of the FP on diabetic uh, animals and patients. For example, Tripathi and et al. Worked on Wister rats. Uh, the results showed that 200 milligram per kilogram of FP for 5 days leads to a reduction in inflammation and oxidative stress. Also, Shukuhi in 2018 showed that 250 milligram per kilogram of FP for 14 days increased the blood levels of testosterone and decreased oxidative stress among 28 male Wister rats. Kushki showed that 250 milligram per kilogram of FP for 21 days decreased the blood levels of lipid and oxidative stress markers in diabetic rats. Again, Shibuhi in 2019 showed that 28 male Wister rats, which are supplemented by FP, the results showed that the quality of sperm in diabetic rats as well as the level of antioxidant enzymes improved. Fatty Azad showed that the extract of FP caused a significant decrease in blood levels of Fumaria parviflora. The extract of Fumaria parviflora caused a significant decrease in blood levels of glucose in diabetic rats, but no significant changes observed in normal rats. Finally, Akramine in 2017 showed that Fumaria parviflora administration resulted in a decrease in inflammation and uremic pruritus among hemodialysis patients. For methodology section, there are 5 main subheadings for methodology section. The first one is the extract procedure, sample size, randomization and intervention, data collection and measurements, and statistical analysis. The extract procedure. First, 300 kilogram pills of FP were wetted and kept at 4 degrees. The wet FP were detached manually, then a vacuum 25 millimeter HG oven at 40 degrees with a 5% dry basis was applied to dry detached FP out. Sample size includes 66 diabetic patients, 33 patients in the intervention group, and 33 patients in the control group. For the randomization and intervention, participants were described randomly in 1:1 ratio to either the treatment or placebo group, classified by age, gender, and APAC-HE2 score, using the random allocation software, also known as RAS. Data collection and measurements. Weight, height, physical activity levels, body mass index or BMI were measured. For statistical analysis, SPSS software was applied. Independent t-test, chi-square test, or Mann-Whitney U-test analysis of covariate test, paired sample t-test, and repeated measures ANOVA and Friedman tests were carried out. The implications of the current study. First, Uh, One of the main implications of this study is to find novel therapeutic approaches, also providing a substantial knowledge gap concerning the impacts of FP extracts on human cells, providing novel methods on how to prepare the extracts of FP, prevent the side effects of chemical drugs. Although the current study uh, had some strengths, there are some weaknesses and limitations regarding the current study. The first one is a small sample size, the low possibility of generalization of findings because of the small sample size, the potential side effects of Fumaria parviflora because there are very few studies showing the potential and adverse side effects of FP, especially on human bodies, and also the lack of sufficient studies. And here are the references I used to prepare this PowerPoint. Thank you for your attention and have a good day.